Okay, so sort of on that note, we're going to start by introducing ourselves. We'd like everyone to introduce themselves. We have some time set aside, so if you could give your name, how many times you've been to La Romana, what you do here, what you do down there.
And maybe what motivated you to come here today and join us, because
Yeah.
some of you came from quite far away, and we really appreciate it.
So again, my name is Chris McKay. I'm an MD PhD student here at UMass, in the thick of things, right in the middle of the program. And I helped coordinate this symposium, so thank you for coming. And I've been to La Romana 5 times now, 5 times on 1-week trips, and then we went last month to do a research quality improvement project, which you should hear about later. And that's why I'm here. Thank you.
And I'm Elizabeth Townsley, and I also help coordinate the symposium. I'm also an MD PhD student here at UMass. I'm getting towards the end, starting back in the clinic soon. And I've been down to La Romana 3 times with the UMass team. I think just to give you guys a quick idea about who UMass is and what we do, we bring medical students down to the DR over the spring break week. Recently, we've been running 2 teams, about 45 people each week, and we do a variety of things when we're there, but like most of you probably, we primarily run outpatient mobile medical clinics in the Bateys. We include some women's health in that, so I think those of you who've done the conference calls with us have seen the pictures of the PATH bus that we do, set our school bus up to do PATH and women's health things. And as we have moved forward in this collaboration, we're sort of changing the way we think about what we do down in the DR and are really trying to move towards more of a sustainable model where we go back to the same Bateys, where we learn more about the communities we're in, where we understand where they get their health care when they don't see us. And so we have to talk about some of those things today too. And I'm going to let, we'll just go around the room. If you're a part of UMass, then you can just introduce who you are, what you do for the team. And if you are part of another group, if you could appoint someone who's like the lead of your group to sort of explain the team, who you are as a team, what you do when you're in La Romana, anything. We want to hear about any cool projects that you think might be different from what other teams do, and why you're here. So, Dr. Grace, would you like to start?
From the village Presbyterian Church in Kansas City. We send 3 to 4 teams a year, about 80 to 95 people, physicians, they do medical and surgical. Fall team is just medical, winter team is surgical and medical, and spring is the same. And we send down this summer many teams I talk about in my talk to have continuity for our application project. I'll tell more about what we do in my talk. Jim Malazinski is
Jim Malazinski, I'm an internal medicine physician. Been going on about 9 years, and I'm just talking today in upper primary care.
Well, also, would you?
Welcome, Melvin. I am a now coaching with the first starting trip. In this room. In this room. I'm not kidding. That's very true, actually. I'm trying to sit in my own seat. Yeah, it's and I am now, I've had a number of global health experiences and run a global health task force in the medicine ambassadors. Slightly shifted into a bigger perspective on global health and in global the second year medical student when we started this. So I'm very interested in talking about their long-term goals and sustainability and empowerment of our partners and thinking about where we're going. And
Okay. I'm Tamara Thayer. I'm one of the professors of nursing at Villanova University, which is in College, and introduce myself. I started going to La Romana in 2007 with Glenn Mercy College, and had some experiences with clinic, and then 3.5 years ago came to Villanova and obviously had to bring this experience with me. It's not the only global health experience that I had. I've been working in Villanova as well, but my heart truly lives in the Dominican Republic. And A couple of years ago, I brought 8 nursing students and really decided I knew the work was, I'd been going there, I knew the work was much greater than what my 8 nursing students could do in the mobile health clinic partnering with Good Samaritan. So then 2 years ago, I brought some campus ministry, got into some construction pieces, and then this past year, brought campus ministry. Going forward in the fall, we're going to bring some of one of our maternal health nurse practitioners and some of our maternal health nursing students as well. A lot of my work as a practicing nephrology nurse has been focusing on the prevalence and the behaviors related to hypertension. Just because anyone who goes out, in the first minute, you see what these blood pressures are, you know the long-term consequences in relationship to kidney stroke, cardiovascular disease, that type of thing. And we'll be back in the fall again. And I'll let my students introduce themselves because they had the opportunity to go with my group last October.
Yeah, my name is Long. I'm a junior nursing student at Villanova, as Karen said, and I was fortunate enough to go on the trip this past year, my first time in Romana, and it was really not only a great trip to go on to open my eyes globally to help disparities in the way that we can provide medical providers, but it was great that we had the chance to give out the hypertension surveys and help him directly do the research out there. So I thought it was a really great experience to start the research process, such a basic level, and trying to help out. My name is Sarah Lamb. I'm also a junior student at Villanova University. Only have been one time it was on call. Hoping to go back again. It was just a really an eye-opening experience to what poverty actually is and the health disparities in the international healthcare system. And it was really cool going there and actually collecting the data and analyzing it now, presenting it today.
Do you guys want to introduce yourself really briefly?
I'm John Lewis. I work for Martin and Worcester. We were invited here to interpret for that video.
They're on their way, don't worry. In the car.
My name is Lee Treasure. I'm also one Spanish interpreter for UMass. And John invited me to come and help him.
John, your turn.
My name is Joey Marchet. Used to work on the interpreter and become American hospital.
Anyone who wants to
So they can't hear us on the internet. So
Could you hear me?
it's not for us. It's for the cloud.
Are there people on the cloud? More to
Oh.
Yeah.
I'm actually a student as a graphic design student at Quincy Gamble Community College right now. And I'm here just to hear the different opinions that you guys have. And that's it.
My name is Christine Shaughnessy, and I'm a nurse at Mass General Hospital. I've been going to La Romana since 2004. I think I've been about 13 times. I used to travel with a group from my hometown, but 2 years ago I started leading my own medical team with nurse colleagues, and we bring a handful of nurse practitioners and doctors with us. We are primarily med clinic. A few of our volunteers will also go to the hospital and pick up with a med team that's already there. The week that we're down there, there's a group from Maine, from Saco, Maine, that is there with us, and they have been going for about 20 years, so they took us under their wing last year and this year too, and have been so helpful that way. So I'm here today to collaborate and learn and meet Bob.
I'm Juliana DeMarchi. I work with Christine at Mass General Hospital, and I went with her for the first time last year, and we went back again in January. And I'm really excited too, starting my nurse practitioner program and looking at the collaboration that's going on, and it seems like there's a lot of really exciting things happening.
So my name is Lawrence Lowe. So in my day job, I'm actually a public health physician. I work as medical health officer for Fraser Health Authority in Vancouver, British Columbia, which is on the west coast of Canada. But I was born and raised in the Toronto area, which is hence my ties to the University of Toronto, etc. And so I am actually the director of operations for the 53rd Week, which is a nonprofit that is based in Brooklyn that was that essentially grew out of our initial work in La Romana. We've been going down to La Romana since '06. I personally have been going down since '09. When I first went down there, I guess maybe it was partly I'm also trained in family medicine, so I do family medicine and preventive medicine. But I think it was my public health background that kind of had me sort of try to take a different approach with some of the stuff that we were doing. So we do provide the mobile medical clinical piece, usually focused on pediatricians because our clinical lead is actually a pediatrician by training, based out of Philadelphia. But I also tried to bring a bit more of a research and a health promotion aspect to what our team does. So we try to essentially do some health education on the side, as well as some research. At least we've done in terms of with UMass folks, kind of coming up with data, trying to understand what's going on a bit better, because I feel that might have a different sort of impact than providing primary care necessarily. So most recently, actually, we have now organized a couple activities with 2 Canadian universities to bring students on their study abroad and help them think sort of about short-term experiences and what they're doing and sort of looking at it in a responsible and ethical manner. And so we had our first group of students from the McMaster University in Canada, and they were down there September through December this past fall, and we're also conducting research projects while they were on the ground there. And I think we are looking to have a long-term relationship with that group. So essentially, we're the 53rd week. I'm going to pass it to the students, and we basically the way I like to think, you can think of it this way: we're the 4 Canadians plus Chang. So that's.
And if that's my introduction, I'm taking this next. My name is Chang Kang, and I am his darker half, I'd like to think. I come with a much different background than him. I have 10 years of pharmaceutical consulting experience, and I am actually an MBA from Yale, and I'm actually leading my own biotech right now. And that actually leads me to think about things in a different way from the way that he's thinking about things. Like Bob has been talking about, like Rick North has pointed out, I think of things from a data perspective, from a long-term, large organizational perspective, and that's the value I'd like to bring to what we do in La Romana. I've seen what the work that Henry and Lawrence have done, my better halves, I feel, and what we'd like to do really is to make sure that that impact is amplified by all the things that we've learned in business over time, to use statistics, to use large data pools, to use all the analyses that we can do in business for the greater good of the people of La Romana. And we also have a secondary team here that's, we hope the future, because both of us are getting old. You know?
What?
Hi, I'm Brendan. I'm Brendan Wong. I'm from Hamilton. I'm just outside of Toronto. We're from McMaster University. We're third-year undergraduate students in global health. And as Lawrence said, we just had the opportunity to spend just over 3 months down in La Romana, where we were able to conduct a needs assessment and really figure out some of the situations plaguing some of the Bateys, which we hope to share with you later this afternoon.
I'm Chris Russell, Brendan's classmate. So yeah, hopefully we can share with you our findings later on and kind of figure out how McMaster's partnership with the 53rd week can have the greatest impact on La Romana as a whole.
My name is Puya. I'm a second-year medical student from University of Toronto. I traveled with Chang and Lawrence just this December down to La Romana on a one-week clinic trip, and it provided me with a good clinical experience, but I think I became interested in more of the long-term goals of the mission in La Romana, and I would like to see, what kind of ideas regarding long-term sustainability that we can discuss here, which is why I'm here today.
And I'm Brian Ferrara. I'm a recent UMass graduate, just started residency at Bay State in combined medicine and pediatrics, so I'm happy to be back for the first time since I graduated. So I went on the trip for 5 years in a row and started out just going and then being one of the leaders of our UMass trip. And I think as you go over those 5 years, you see a larger perspective. Maybe Olga also felt the same way. And so I think that the last couple of years working towards having a meeting like this was what I was hoping for, so I'm very glad to be here for it.
No, I wasn't supposed to speak. What's going on here? I'm kidding.
Well, my name is Junior Belisea. Right to introduce myself? Yeah. Okay, good. I'm Junior Belisea. I'm actually from the Dominican Republic. I lived there for all my life. I've been in the country now for a full year. I actually worked at the hospital. I was running the interpretive department programs and helping with the social programs. So did that like for many years, working alongside with Moises. You guys know that name, Moises? Yeah. Yeah. So my wife Sarah is here. She's going to introduce herself in a minute. And I'm sorry about my boy being so loud. So I'm glad to be here. Actually, I'm glad to see a lot of beautiful faces that I've seen before. And then thank you. Anything else? Good.
My name is Kevin D'Angelo. I'm from Buffalo, New York. I'm a private practitioner dentist that started going to the Dominican Republic about 15 years ago. Started out in Bani, which is west of Santo Domingo, with a convent down there. And they closed up about 4 or 5 years ago when I met Moises and joined up with the Buen Samaritano. We do a dental clinic once a year. Actually, was doing 2 a year before, but we're doing it once a year during the spring break of University of Buffalo Dental School. And volunteer professor there, and we bring students down on our mission trips every year to perform extractions and fillings, preventive dentistry also. Our next project really is we bought a 36-foot motor home dental clinic, and we bought it from the school that they retired it from another project in Western New York. And we're shipping it down hopefully soon. We're going down on March 16th, and it might not get down there. The military is supposed to fly down in a large transport aircraft for us, but we're waiting for that to happen. My long-term goals here really is to coordinate ongoing dental clinics with this motorhome to the Bateys and set up small teams that can go. We have a large source of equipment that we set up, because we have usually about 20 people that go down and set up our clinic, but it's very cumbersome, and it's a big project to do that and to go out in the Bateys and set up a clinic. So with this motorhome, we hope to have ongoing small groups that can go all year round, and like to coordinate with like this group here with people who know other dentists or working in. And we a lot of times go with medicine, medical personnel also. So I'm really excited to get to know more people and get contacts and website and also kind of join in on the data taking up for the project. So thanks for being here.
My name is Michelle Pugnier. It's been over 10 years, and I've been going down. After that, you forget how long you've been going down. I'm also, I've been at UMass for 30 years, so I'm probably one of the older people in this room. And I initially became interested through the church in Sterling, and so I had my first trip there as a practitioner. I'm a family physician by training, and went down for several years until I did this presentation to the students at UMass. I'm the Senior Associate Dean here for Education, which is where I spend most of my time, in that other lecture hall. And then the students took off with this concept thanks to Olga Waldman's energy and relentless emails to Moises. So now my interest is less as a practitioner, even though I still love going down there as a practitioner. I will say that I was the first person to do a PAP on a bus, and no one thought it would work, and hence the PAP bus. Yes, we did. Remember, Jen? I said it was possible. No one believed it could be done. But my pleasure now is really going down there because I'm a big believer in education as the ultimate tool for change. And in my role here at UMass as Senior Associate Dean, I have the privilege of working with my students and sponsoring our trip and watching it grow and seeing people like Elizabeth, Chris, and Caitlin and others and Vivek take on these leadership roles that are going to, I think, put us in a much better stead in the future because they know all about this technology stuff and we don't. And the other thing I wanted to say was that it may be worth looking at consistent pedagogical concepts. We're going down there with medical teams and we're trying to organize ourselves around formularies and meds. What are we teaching our students? And I think this is an opportunity to capture that because learning management systems and technologies are such that we can do this in a fairly streamlined way. I see a tremendous opportunity for education that's really bilateral in exchange in terms of our students learning more about global health and also how to be better doctors or nurses, because interprofessional is important, and also doing teaching for the individuals at La Romana. So I think the real long-term solution is really an educational one, and I include in that patient education. So I'm all about teaching, although I love going down there as a clinician, and that's really, I love it because the students do all the work when we're down there, and I just get to do pure, unadulterated patient care, which is great. But if you have an interest in education, and if you have some time, we have like an outstanding simulation center with digital remote capacity for video streaming, and also potentially for training in a simulated environment. And I'm happy to give you guys a tour later on if you want to take a look. And I actually think we could leverage educational technology in this context in a way that would really fortify education on both sides of the Caribbean or the Atlantic, or whatever separates us from La Romana. Thank you.
Hi, I'm Jean Boucher. I'm from the School of Nursing here. I'm a nurse practitioner, and will be my second year going to La Romana. Our nursing school has gone for, I think, at least 5 years, and it's a wonderful experience that we wanted to expand more than just the 1 week a year, obviously, in terms of what we're doing. And Elizabeth and I have had some initial conversations about collaborating with the nursing group in La Romana, and knowing that we can beam the simulation experiences could be helpful, so we'll talk more about that. But I would also love to talk with you, Olga, you all from Vanderbilt and Mass General, because I think we could definitely collaborate and keep in touch by email, et cetera, and work together. And I'd also like to talk with about how do we prepare our students more in terms of the translation and you know, our work together in terms of our communication piece. So more of a newbie in this, but I think it's a great opportunity.
Thank you, Rick.
Thank you.
Thank you. Sorry we have to leave for a birthday celebration. Glad to be here.
Good morning. My name is Bob Beck, or better known as rbeck.jr@gmail.com. Because that's the way I typically communicate with most of you people, and I'd be surprised if I haven't communicated with one or two of you in that fashion. I want to start by thanking Chris and Elizabeth and Brian and Olga for making this finally come together. They've worked on it. It really is an accomplishment, and you've done well. Not to leave anybody out, because I know you folks have all worked.
Yeah.
Well, it's a good beginning. I try to keep this thing called Good Samaritan Mission Council together, and it's pretty much a hub of communications for those that have come to find it. I think one of the most important things that I do is I transfer funding from U.S. donors to recipients in the Dominican Republic, primarily the hospital, but not entirely. Scholarship funds and funds that support families in Bateys and things like that go through GSMC. I've been going to La Romana long enough to collect a pension, and you know, it won't be too long before one of you folks is going to step into this role, and I look forward to that. It's really a privilege to be here today and see all of you folks and the interest and the heart that you have for not only the profession that you're in, because I can see the professionalism that you have, but also in the way that you have a very loving and caring feeling towards the people that ultimately we serve. My goals, I share every goal that every single one of you has, and that I've heard you articulate this morning, because I think it was, I don't know who it was, but someone mentioned that Brian, after you've been there for a number of years, 5 years or so, you start to be able to put some things together. And over the years, the primary goal that we had was we are going to stop babies from dying, because that was our big problem when we first started going down there. And I'm not saying that that's completed, but it's like a Coast Guard activity, right? You want to save everyone, and we're still on that kind of a mission. But over the years, my goals have kind of evolved, and the goal that I have now is sort of in line with Michelle's, and it's education, but on the broader sense, because the goal that I have today is I want to see a baby born in a Batey be president of the Dominican Republic. And that takes a lot of doing. And what you folks do on the medical end of it has as much to do with it as anything else, because the first thing they need to do is survive. And we're still very much in that business. So I thank every single one of you for being here today. I hope this is just the first of many that we're going to have. And between last year and this year, it looks like the numbers have increased exponentially. And I would hope that next year they will increase exponentially once more. I've already announced next year's conference for you. Thank you.
I'm David Katz, and I'm a family doctor. I practice in Western Massachusetts. And I trained here about 35 years ago and have stayed somewhat connected since then, which is how I got recruited. So this March will be my third trip to La Romana. And so I go down with the medical students and do precepting and practice medicine. And as Michelle said, it's nice because we can just see patients and not have to do paperwork and billing and all that stuff. So it's all fun. And so I'm here today to learn more about the big picture, and like everybody else, trying to make my time there as valuable as possible and as meaningful as possible, and try to coordinate and get the big picture and try to make the greatest impact. So I'm interested in hearing about everybody's ultimate goals of what we want to achieve, and try to
Hi, so my name is Caitlin Fogarty. I'm also a UMass student, MD PhD student, and hopefully all of you got a frantic email from me asking you to fill out my survey about the referral project. If you haven't completed that survey, I might ask you to track me down during lunch, so that way I can get a couple more responses to increase my sample number. But I will be presenting some preliminary findings from that project later this afternoon. Just like the other UMass students, I've gone down 5 times now. I'll be going back in March, and I'm very excited to see so many people in this room, because it is sometimes very frustrating knowing that there's a lot of miscommunication and misinformation going around, and it's not any one person's fault or responsibility. But I think one of the greatest things the smallest changes we can make to make the greatest impact is just getting things out in the open as to what is the process, what is the situation that we need to be, what are the facts of why we're there and what we're doing and how we should be doing it. And I think just making some small streamlining changes to make sure everyone's on the same page can go a long, long way. So I'm really excited for that.
Hi, I'm M.A. Powers from Wallingford, Connecticut, and my husband and I have been leading groups down in the Dominican since 1990. I just was perusing old pictures the other day, and I have pictures of us pouring the footings for the cement for the footings of the hospital. So, I look at this through those eyes, and this day, and I really just see it as a miracle. So, kudos to everybody who just keeps pushing forward. And heading in a direction that just allows more growth and collaboration to benefit the people down there. Our group, usually of 80 to 90 now, we have medical team, but we also do a lot of construction. We do water filter setups, and we do evangelism, and then teaching team, which is our team that just helps the teens that don't know where they belong have a lot of fun with the kids down there and just have a really meaningful experience. I'm a physical therapist. My experience traveling down there with groups has primarily been as a mom bringing our 3 kids down on the trips. But now that they're getting a little bit older, I'm shifting toward really starting to think about how I, as a medical professional, can use my knowledge down there. And that's just starting to happen for me. The other blessing that God has opened a door for is my husband's been teaching as an adjunct at a local university, Quinnipiac University, and has had the opportunity to start bringing students through the school down for service trips. And I have 2 Quinnipiac students with us today. And as all of you, they're just finding it life-changing, but it's been really, really awesome to see how it just directs their career path, that where they knew they were going all of a sudden shifts a little bit because they know now that everything they do, they look at through the lens of how can I be a benefit and a blessing to the people down in La Romana. My husband also serves on the Good Sam Council, so I'm here representing him because we're very, very invested in Good Sam and just wanting to see things continue to prosper. And I think you guys have all said this, but one of my passions as we continue to do what we're doing today is to constantly put myself in the shoes of somebody down there, especially at the hospital where they do, to me, a phenomenal job, and to just guard my own heart and mind against assuming that I'm better than those people. Even though we've had the blessing of wonderful education and resources that they don't have down there, but to just constantly really try to, keep. So it's like an encouragement and a challenge for all of us, which I think we know, but I just want to remind us all of that.
Hi, I'm Sammy Limbaris-Kaufman. I'm a senior PT at Quinnipiac, and I went down this past winter with our class, and I'll be going back again in June. And with the powers, and what May was talking about a lot was like, a lot of us went down thinking we knew what we wanted to do with our lives and what we wanted to do when we graduated. And for me, when I went down this past winter, everything I wanted to do changed, and I wanted to go down there and work for the hospital and do PT down there once I graduated. And a lot of the students that were on the group had similar thoughts and like that, and they're going back with us in June as well.
Hi, my name is Jessica Patel, and I've been to the Dominican Republic twice now, going back in June. And I'm a biology pre-med senior, biology pre-med student at Quinnipiac University, so I want to go to medical school. I actually had the opportunity to shadow Lawrence and Henry and Chang, everyone, last December, and it just really opened my eyes, again, like everyone said, to just how else we can help and how to make things long-term and sustainable. So I just want to hear what everyone has to say, and I'm just here to learn.
My name is Vivek. I'm a fourth-year med student, but I'm graduating in 2015 now. I am one of the leaders for the UMass trip, along with a bunch of people over there. I'm pretty excited to just kind of listen and meet other people who've gone before. I've gone twice before, and I'm over the past couple of years with Elizabeth and Caitlin and Brian. Talked a lot about how we can make our trip and the UMass trip better, and we're starting to implement some changes. So I'm excited to kind of listen to other people, hear some other ideas, and see how we can move our trip forward.
My name is John Bogdasarian. I think I'm an anomaly here, both from standpoint of age, being maybe the oldest person here, and also from specialty. I'm an otolaryngologist who practices in Fitchburg, Massachusetts. I've made, I think, like Michelle, I've lost count of how many trips I've made to La Romana. The last was probably about 4 or 5 years ago, and now I've been going to the other side of Hispaniola to Haiti, where I've made 3 trips and am scheduled to do the 4th. I don't really have lofty goals. I go, I think, to La Romana and also to Haiti to see what I can do to help out. And I try to stay out of the way while people who know what they're doing practice medicine. I get an opportunity to watch, though, and and remind myself what it's like to practice real medicine, as many consider otolaryngology not to be in that field. But I've enjoyed it, and it's been wonderful to see the evolution of this organization and the progress that's been made in the hospital and in data collecting and all the things that are happening, and it's been a lot of fun to watch it. Before I stop, just one favor to ask of the Canadians. When you guys go home, if you don't mind taking Justin Bieber back with you, we'd appreciate it.
Hi, I'm Jennifer Colburn, and I'm from the First Church in Sterling. I've been going to La Romana since 2001. My church has been involved since, I believe, 94 or 95. So it's been a long journey. I can't tell you exactly how many trips I've gone on because I am very confused. I also had the privilege and the blessing to be able to spend about 11 months living in La Romana, working with many of the teams that are here today. And it was an absolutely incredible God-given experience. And, you know, the lessons I learned down there are just absolutely incredible. The people I met are some of the most beautiful, caring, compassionate people that I have ever met anywhere. The practitioners at Good Sam Hospital are absolutely amazing. I have seen them save babies that American doctors said were not going to live through the night. One of them, my personal favorite little boy in the world, is now 9 years old. And it's just been an amazing, amazing process to witness. And, you know, my goal in doing this and in continuing this is to make sure that people have access to health care. And not just access, but also to have the information to make choices about their health care. You know, if you've ever seen the look on a woman's face when she is given the option to, you know, when she's given the information to understand the option of family planning, that's just incredible to watch. You know, when she understands that she can use this not just to not ever have babies, but to make it so that she can take care of the babies she has. You know, it's just an amazing, amazing thing. And, you know, I for one want to see it continue. So, thanks.
Okay. Hi, everyone. My name is Victoria Winslow. I'm a first-year medical student, and I'm the president of an organization called Students for Haiti. I primarily came here today because I wanted to hear more about, you know, the foundation and maintenance of healthcare clinics. And, you know, I've also come here today to share some information about the databases that my organization has been working to create to improve communication and collaboration between student groups and NGOs that focus on Haiti. So, yeah, I'm really looking forward to hearing from everyone, and yeah, that's about it.
Okay, my name is Laura Betcher, and I don't really know how to quantify how long and how many times I've been in La Romana. I lived there for 14 months between 2010 and 2011, and I was a Peace Corps volunteer, and while I was living in La Romana and affiliated with the Clínica de Familia in La Romana, I was working specifically in the Bateyes and coordinating with other organizations in the Bateyes to mainly focus on HIV prevention and other social services. So I'm here because Lawrence and I connected at APHA, and he invited me to come give a presentation about some of the collaboration that I did and how that might inform your future collaboration. I'm also personally interested in the Bateyes, and I mean, it's like you as well, and I'm sure many of you, where I have a godchild, I have friends, I have people who I consider my family, you know, who took care of me while I was sick, all of that kind of stuff. And so I would love to continue to participate in Batey health and Batey medicine.
Hi, my name is Valerie. I'm a first-year medical student here at UMass, and I'm one of the trip leaders for our group's trip in April. I've never been to the Dominican, so I'm excited to be going in April. And I think one thing that our trip is focusing on, which Elizabeth touched upon, is this kind of public health survey to really assess the needs of the people that we're serving down there. So I'm excited to get on board in that so early in our careers and see where it leads us over our medical education.
Hi, I'm Michaela Tracy. I have the same story as Val. I'm a first-year medical student here at UMass. Also have never been down before to the DR, but really looking forward to going and from hearing all of your expertise here today.
Don't want to beat a dead horse, but my name's Alec Boardman. I'm also a first-year leader on the Dominican Republic trip for UMass. I kind of joined the trip initially just wanting to volunteer abroad and in a clinical setting, but I think as I've experienced becoming a leader of the group, I'm really excited to learn more about how we can implement our needs-based assessment and how we can learn more about the people we're serving, as Val said. So excited to learn more.
Hi, my name's Rebecca. I'm a fourth-year MD-PhD student at UMass, and I'm just helping out with the finance aspect of the trip for UMass students since Elizabeth will be moving on to finish up the program.
Hi, I'm Sarah Belisea, and thank you all for your patience with my toddler. Junior and I both really wanted to be here today, so that left us no option but to bring him with us. But if he does get really disruptive, then we'll take him out. But I feel like I kind of came of age in La Romana. I lived there on and off for about 6, almost 7 years. After high school, through college and grad school. So I was sort of able to get credits. I was studying master's degree in international development and social change. So I've kind of done a whole bunch of different projects and worked on different things down there, and it's really become family in a very literal sense, but but also just the people at the Good Samaritan Hospital truly are my family. So I've worked in many different capacities. As I said, one of the programs that I most recently was working on was the water filter program at the hospital, helping to kind of fix some technical issues with the biofan filters, and then really coming up with a distribution program and an education program to go along with it. And that's something that I think has really taken off and is going well. So I come at this from a development perspective, from definitely an interest in global health. Although I don't have formal schooling in that, I think that that's kind of what has been my interest all along in this work. Thank you. We'll see if I can stay the whole day. I'm not sure.
Okay, so we also have a few people joining us from the internet. We have Betsy Black, who is from Gwynedd Mercy, and she has she wanted me to introduce her group. So she's a faculty member at the university and has been to La Romana for 30 years, 9 years working with the Good Samaritan Hospital. Her university takes RNs in the BSN program down to give healthcare through clinics to those in the Bateys, and also to get a perspective of healthcare in La Romana area. And it was sort of, I think, Tammy used to work with them, and then she went to Villanova and started another group, but they still work together. And then also on the line we have Dr. Bob, who is in La Romana, I believe, and with Dr. Bob is Cindy and Julie. So they're listening as well, so I would say hi to them. And then we also have Rob Honig, who's a physician, family physician, who works with us on the UMass teams, and Tony Malone, who is a pediatrician who works with us on the UMass team, and Ruth Biggs, who I don't know, is that your wife? Who is Al Biggs? Sure. Okay. Making sure you're not in trouble.
I think that raises my rough count of groups participating to 13 different organizations that go down to La Romana. So hopefully we can make some really great connections today and some partnerships for going forward and learn a lot about what each of us does down there. So we're going to have a short break now. People can get coffee, use the restroom, grab another bagel if you're hungry, and hopefully Wojciech and Dieter will be here really soon and we'll get started again. Thank you. So there's two options. I could give my